Recently, a relative of mine lost her limb to diabetes. That is, her limb was amputated. Let's talk about diabetes. Hi guys, welcome back to my channel. So today I'll not be giving you the normal thing I talk about pathophysiology of diabetes. Today I'll be talking about the do's and the don'ts of diabetes, what a diabetic patient should do and the things a diabetic patient should not do. And when I interacted with my auntie, when I spoke to her, I asked her some few questions, and this is I'm about to teach you. I told her and I asked her if she was doing it or so. She was like, she has never heard of it before. Nobody has told her. Nobody had given her any of these tips before. And I'm like, what? Because these things could have prevented the amputation of her leg. And I took her home and I was like, it cannot happen again. It cannot happen again. And she's not the first person I've spoken to. I spoke to other few diabetic patients, just a small interaction with them, and to my greatest dismay, they also know these tips. So today I'll be telling you these things, so you should not reach the point where your leg has to be cut off or your limb, you need to lose your limb because you did not know. If you have a diabetic patient or you know anybody who is diabetic, it could be your sibling, your mom, your aunt, stay tuned and learn. The first and the easiest do is inspect your leg every day. Inspect your feet every day. When I say inspect your feet, I mean in between your toes, under your feet, the soles of your feet, every blessed day. You must not be the one to do it. Your sister can do it, your relative can do it, but ensure that every blessed day you inspect your feet. Why should you do this? See, the diabetic patients, they have a lot of things going on. After a long time of suffering from diabetes, they have a lot of pathophysiology going on within their body. I'll just talk about two which I want to use and explain here. There's something what we call diabetic neuropathy. Diabetic patients, after a period of time, they lose their ability to feel pain. Like you can have a wound and they will not know they have a wound. I had a patient in the hospital who came the 3rd degree burn. He had that burn, it was 1st degree, but he did not know he had the burn. Actually, hot water poured on his leg and he was not even aware that water poured on your leg. Can you imagine that level? So it was his daughter that noticed the progression of the wound and noticed that, hey daddy, you have a wound on your leg. He did not even know. Can you imagine? So that wound, that burn had progressed from 1st degree to 3rd degree. It had really gone right deep. So there was a very big difference. So make sure you inspect your feet. Diabetic patients, as I said, they lose their ability to feel pain. So you have to catch up these things very fast before they get worse. Since you are realizing you are weaker on one point, you have to be 2 steps ahead so you don't be like this patient or you don't be like my aunt. The second easiest do is wash your feet regularly. I'm sure this point you'll be like, I wash my feet regularly. When I say wash, I mean you should be intentional about washing your feet and in between your toes. As I said, diabetic patients go through a lot after having the disease for a period of time. Also, they also have their immune system becomes weakened. So you have to make sure that you don't give a breeding ground for bacteria, a breeding ground for fungi. So always make sure you wash your feet every day with clean water in between your toes and make sure they are dry, as I said, to prevent infections. Because diabetic patients, you can have something you will not know you have it, so you have to do these preventions to be at least 2 steps ahead of the disease. The third one, and this is like the best one I like telling my patients, always keep your feet moist. Always apply Vaseline on the heel of your feet, on pressure areas like your first toe, that area is a pressure area. Your sole, always apply Vaseline to that area. Why should you apply Vaseline? What Vaseline does, it helps to keep your feet moist. It helps to keep your feet fresh. You know, when your legs are dry, it's very easy for you to have a scrape, a wound. As I said, when you have these things, it's very difficult for you to know you have it because you have lost your ability to feel pain. Or if you find out when it's already at the critical stage and then you have your leg amputated. So Vaseline helps to keep your legs very moist and fresh. The next point, do not walk barefooted. Do not walk barefooted. Always have soft cotton socks on, because as I said, diabetic patients, when you're barefooted, you can easily hit your leg on the wall. You can easily smash a sharp object and going to cut your feet and give you that laceration and give you a wound, and you will not even know you have a wound. So always wear soft socks when you're at home. The next point, when putting on your shoes, endeavor to put them on with socks. Your shoes are hard. They can give you a wound. They can give you, especially on these pressure points as I spoke of, the heel, the sole, the tip of the toe. So always put on soft socks when you're wearing your shoes, as to prevent wounds in these areas, which will be very difficult for you to detect. The last but not the least point, if you have a wound, a burn, a scrape, anything, please take it to the hospital. Please. Don't do self-medication, don't do self-cleansing. As I said, diabetic patients have a weak immune system. I can have a small crack on my hand, I can take me 2 days to get healed. A diabetic patient can take a diabetic patient it can take a diabetic patient 1 month, it can take a patient 4 months. It will not get healed. So please take it to the hospital. In the case of my aunt, she had a wound, but they didn't self-cleaning the house, they're using cold warm water, salt and everything and cleaning it, and it was getting worse. It continued and progressed for months, and once like that they progress, giving the fact again that she has a weak immune system. So please, if you have a wound, a scrape, please take it to the hospital. Seek medical attention. Don't do self-healing at home. We are here to help you. I'm praying and crying in my heart that this video reaches the right people. I really pray it reaches the right people. If you watch to this point, I am so grateful. I know each of us must at least know at least one person that has diabetes. Please help me share, help me educate, let people know about this. People deserve to know about this. I'm tired of hearing diabetic patients crying also their legs are being amputated. They did not know. Now you know. Now I know that I have done my part. Please do your part and share the video. Help a relative, help a friend. Just help me share. And if you have any other questions concerning this, any other tips, please comment, ask me. I'm going to explain. Thank you very, very much. See you in my next video. Bye bye.